E-Content. Student Teacher, Parvati A.S. Class, 10th. Subject, Biology. Chapter 4, Keeping Diseases Away. Concept, Haemophilia. Objectives. To understand the history of haemophilia. To recognize the reason for haemophilia. To predict the disorder from the given story. To illustrate the signs of haemophilia. To analyze the treatment method of haemophilia. To explain the types of haemophilia. To give awareness about the haemophilia. Hello dear marvels. Welcome to my new video. Every day is a brand new day with interesting information. Today we are going to study about a rare genetic disorder. One day Eric was playing football with his friends. While playing football, Eric fell down and had a mild knee injury. His blood didn't clot and he bled for a longer time. So his friends took him to the hospital. After diagnosis, doctor reported that he is suffering from a bleeding disorder and asked to follow safety measures to avoid injuries. So, do you know which is the bleeding disorder Eric is suffering from? Yes, correct. Haemophilia. History of haemophilia. Haemophilia has been called a royal disease. This is because the haemophilia gene was passed from Queen Victoria, who became Queen of England. She had two carrier daughters, Alice and Beatrice, and a son with haemophilia, Leopold. Leopold, Victoria's eighth child, was the first member of the family to manifest haemophilia and he died at age 30 from bleeding after a minor fall. Haemophilia is caused by a mutation or change in one of the genes that provides instructions for making the clotting factor proteins needed to form a blood clot. This disorder is characterized by uncontrolled bleeding and the inability of the blood to clot properly. Even a small cut or a minor injury can result in severe bleeding. Blood contains many proteins called clotting factors that can help to stop bleeding. People with haemophilia have low levels of either factor 8 or factor 9. Haemophilia occurs in about 1 of every 5,000 male births. The associated genes are found to be present in the X chromosome. So, it is more common in males than in female. Since males have a single X chromosome, if it is affected they will have the disease. In females, however, both the X chromosomes will need to be affected for them to have the disease. If only one X chromosome is affected in females, then the other X chromosome will show a dominant effect and she will only be a carrier and will not be affected. Carrier woman will pass the genes to her descendants. The gene that causes haemophilia is passed from parent to child. A mother that carries the gene is called a carrier, and she has a 50% chance of having a son with haemophilia and a 50% chance of having a daughter who is also a carrier. A father who has haemophilia possesses the gene and passes it on to his daughter because daughters receive two X chromosomes, one from their mother and one from their father. This is why daughters of men with haemophilia are called obligate carriers. Since sons only receive a Y chromosome from their father, they would not have inherited haemophilia. If father is having haemophilia and mother is a carrier, then 50% chance that each son will have haemophilia. 50% chance that each daughter will be a carrier of the haemophilia gene. And 50% chance that each daughter will have haemophilia. Types of haemophilia. There are mainly two types of haemophilia. They are haemophilia A and haemophilia B. Haemophilia A is called by two other names, classical haemophilia, because it is the most common of the haemophilia types. Another name is factor VIII deficiency haemophilia, because it is the lack of the factor VIII protein in the blood that causes the clotting problem. Haemophilia B, also known as Christmas disease, named after Stephen Christmas, the first person to be diagnosed with this distinct form of hemophilia, and in another name factor IX deficiency hemophilia, because factor IX is the blood protein which is lacking in hemophilia B patients, and its absence slows down the normal clotting process. Another rare type of hemophilia is hemophilia C, also known as Rosenthal syndrome, is caused by low levels of factor XI, another blood protein required to make a blood clot. Hemophilia can be mild, moderate, or severe depending on how much of the clotting factor is in a person's blood. The clotting factor level in the blood of a patient with mild hemophilia is between 5% and 40%. Patients with moderate hemophilia have between 1% and 5% of clotting factor activity in their blood. Patients with severe hemophilia have less than 1% clotting factor activity in their blood. Bleeding into the joints. This can cause swelling and pain or tightness in the joints. It often affects the knees, elbows, and ankles. Bleeding into the skin, which is bruising, or muscle and soft tissue causing a buildup of blood in the area, called a hematoma. People with hemophilia may have any type of internal bleeding. Bleeding in the head and sometimes in the brain, which can cause long-term problems, such as seizures and paralysis. Death can occur if the bleeding cannot be stopped or if it occurs in a vital organ such as the brain. Bleeding after having shots, such as vaccinations. Other symptoms may include bleeding gums or mouth, coughing or vomiting blood, blood in the stool or urine, heavy menstrual bleeding. Treatment. The best way to treat hemophilia is to replace the missing blood clotting factor so that the blood can clot properly. This is typically done by injecting treatment products, called clotting factor concentrates, into a person's vein. These infusions help replace the clotting factor that are missing or low. World Hemophilia Day, WHD, is celebrated on April 17 each year to raise awareness about hemophilia and other inherited bleeding disorders. It is an initiative of World Federation of Hemophilia. The World Federation of Haemophilia, WFH, is an international non-profit organization dedicated to improving the lives of people with hemophilia and other genetic bleeding disorders. The theme for this year's World Hemophilia Day is Access for All, Partnership, Policy, Progress. Bleeding disorders are not the end of the world, you could still lead a normal life. Activity. What is the another name of hemophilia? Answer: royal disease. What is the another name of hemophilia B? Answer: Christmas disease. Which is the clotting factor absent in patients with hemophilia A? Answer: factor VIII. World Haemophilia Day is on. Answer: April 17th. The clotting factor level in the blood of a patient with moderate hemophilia is between. Answer is between 1% and 5%. Royal disease is common in male or females? Answer: it is common in females. What are the signs of hemophilia? Answer: bleeding into the joints, bleeding into the skin, bleeding of the mouth and gums, bleeding after having shots, such as vaccinations, bleeding in the head of an infant after a difficult delivery, blood in the urine or stool, frequent and hard to stop nosebleeds. Thank you.